Good afternoon, everyone. This is Dr. Val R. Cush, Chair of the Montgomery County Board of Commissioners, and we've been having a little bit of technical issues, so I just want to check to make sure that my team can hear me. Okay, sounds like it sounds good now. Okay, great. Sorry about that. So today is Wednesday, August the 12th, and this is week number 23 here in Montgomery County with the COVID pandemic. And this is our 7th week in the green phase. So today, before I launch into our normal COVID briefing, I do want to give you some follow-up information about the hurricane last week. It caused just devastating damage across a number of communities in our county. And in response to widespread wind and water damage in southeastern Pennsylvania last week, the Montgomery County Department of Public Safety and our surrounding counties have been working with our voluntary agencies active in disaster, known as VOAD partners, to establish the Hurricane Isaias Home Cleanup Hotline. If your home sustained damage during the storm and you are in need of assistance, you should call toll-free 1-844-965-1386. That's 844-965-1386. Your information will be shared with volunteers from local disaster relief organizations, community groups, and faith communities. You may be contacted by a representative from a participating organization who will determine whether or not they are able to assist you. Examples of services that these volunteer groups provide are cutting fallen trees, removing affected drywall, flooring, and appliances, tarping damaged roofs, and mitigating mold. All services are provided at no cost to you. Help is not guaranteed, however, as the resources are limited. The Hurricane Isaias Home Cleanup Hotline will remain open through Friday, August the 28th, 2020. Calls are answered by volunteers generally during business hours, but you can call and leave a message at any time. A volunteer will return the call as soon as possible. In addition to calling the hotline, you should contact your township or borough as soon as possible to report your damage. Even residents who don't need cleanup municipality. And I just want to thank all of these volunteers. This is such a wonderful example of how our community pulls together no matter what. We've been doing so for the last 23 weeks, and we will continue to do so for the foreseeable future, no matter what the emergency is. So on to our COVID-19 updates. Since our August 11th press release, which was yesterday, we have had 40 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 10,056 cases. So we did cross that 10,000 mark a couple days ago. These positive cases are a result of a positive test for the virus, not from the antibody test. Today, 2 of those are from long-term care facilities, and 6 are from the Montgomery County Correctional Facility, leaving 32 from the community. Of the 40 tests, 3 tests were conducted on July 14th or 15th, 5 tests were conducted between July 24th and 28th, and the remainder, 32 of these tests, were conducted between July 29th and August 11th. These positive individuals are from 18 municipalities, and all 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 9 years old to 79 years old. And as always, you can check our county maps at moncopa.org/COVID-19 for updated geographic information. Today, we have 19 females and 21 males. I am pleased to confirm that no additional Montgomery County residents have lost their life to COVID-19, which leaves us at 823 deaths confirmed positive from COVID-19. The 383 males overall have lost their lives to COVID-19. In terms of hospital beds, today we are seeing our best number yet. We have approximately 42 individuals hospitalized with COVID-19 in Montgomery County hospitals, with only 3 of those individuals requiring a ventilator, or approximately 7%. So that is certainly wonderful news. Now I have an update from the correctional facility today. For the last several weeks, Montgomery County Correctional Facility has been consistently seeing about 18% of individuals booked into the correctional facility testing positive for COVID-19. These individuals contracted the coronavirus prior to entering the correctional facility. All new commits undergo testing and a quarantine process as part of their intake. All positive individuals, currently approximately 30, are in isolation and currently stable. Additionally, since Sunday, August the 2nd, a total of 16 inmates in the general population have tested positive for COVID-19. These individuals are in isolation, and their cellmates and housing units are in quarantine. 2 of these individuals are currently hospitalized. The remainder are currently stable. Additionally, 9 staff members at the correctional facility have tested positive. All of the staff members are currently stable. We have continued to keep the population in the correctional facility as low as possible. Since the President Judge issued the initial March 12th, 2020 order declaring a judicial emergency, the population in the correctional facility has gone from 1,342 to 837 today, a net decrease of 505 individuals, which is a 37% decrease. There have been a total of 1,676 discharges. Now, an update about our community testing sites. As a reminder, the county has 6 COVID-19 testing sites open in a variety of places around the county. None of these sites require a car to be tested. These sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works in Montgomery County. These county-run sites provide testing at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age or need to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. So the new news is that our Willow Grove site, which is currently at our county building at 102 North York Road, will be moving after testing on Friday. So nothing will change for this week, but beginning Monday, the Willow Grove site will be located at the First Baptist Church of Crestmont, located at 1678 Fairview Avenue in Willow Grove. And again, that's the First Baptist Church of Crestmont, located at 1678 Fairview Avenue in Willow Grove. And it will open for testing Monday, August the 17th at noon. It will have the same hours, Monday, Wednesday, Friday, from noon to 2, and Tuesday and Thursday from 4 to 6. And I just want to thank Pastor Jerome Coleman for so warmly welcoming us to the site of the First Baptist Church. They have better parking there and a little bit easier access, quite a bit more room. So we're very happy about this and think this will be a very welcoming site for anyone who would like to test it in the Willow Grove region. Additionally, we continue to have our site in Pottstown at the Montgomery County Office of Public Health, 364 King Street in Pottstown, the Lansdale site at 421 Main Street in Lansdale, the Green Lane site at Deep Creek and Snyder Road in Green Lane, the Ardmore site at 114 West Lancaster Avenue in Ardmore, and the Norristown site at 1401 DeKalb Street. It's in the parking lot of the Delaware Valley Community Health Center. To register for a test or find out the hours of any of these sites, you can go to www.montcopa.gov movegov.org/COVID-19. Click under the green County Testing Information button. And as a reminder, appointments open at 8:30 in the morning on the day of testing. Now, you can also make an appointment by phone. You can at 610-970-2937. That's 610-970-2930. And again, that starts at 8:30 in the morning. We do have Spanish-speaking operators and language line available by phone. Finally, we will be starting to send our tests to the Mako laboratory early next week. And again, expect to see 36-hour turnaround time on those tests. So we will confirm the day that we actually do start, but we are planning for early next week. So good news there. So we are continuing to reduce the is fantastic news. But again, I have to remind everyone that this is no time to let up. We need to continue doing what we're doing so that we can keep the spread of virus as low as possible in our area. This will let our businesses stay open. This will help our children get back to school. It will keep our hospitals and our first responders safe. So we're going to go through our normal graphs here today, starting with our date of test graph. And today, this graph is current through August the 7th. And you can see that on the big picture graph that the lines continue to move in the right direction. And if we zoom in on a more close-up of the last several weeks on this graph, you can see that our 14-day average and our 7-day average for our community cases continue, both of them, to move in that correct direction. So very happy to see that. Also happy to point out that our long-term care facility numbers remain still quite low. Their 14-day average is 1.1 case, and the 7-day average is 1.7. So obviously, we hope that these numbers continue to stay in that very, very low range. I want to thank everyone working at our county long-term care facilities who have worked so hard to keep those residents safe. We also have today an updated graph of our age cohorts. And just as a reminder, we showed this graph 2 weeks ago. On the left, you can see the different census age brackets and the percent of population of individuals in those age brackets according to the census. And then that next column is the percent of total cases on May the 1st. So we sort of think of that as our baseline. Our numbers were pretty. What that looked like on July the 29th. And next to that, you can see an up or down arrow that shows the change from May 1st to July the 29th. And then our new column this week is where we are as of today, August the 12th. So you can see that in that far right column, that in terms of our younger age groups, we are continuing to see slight increases in each of those age groups. But if you look at the numbers, they're not dramatic, but they are certainly still continuing to rise. So, in our case, anybody that's under or really 35 to 44 in that cohort, we are continuing to see increases in those ages. The 45 to 59-year-old group is, fairly stable. And then in our older individuals, we're seeing those numbers go down slightly. And I think, of course, some of that is a reflection of a greatly improved situation in our long-term care facilities. So I share this age information with you just to stress the fact that it is still out there, and we are seeing it more spread now in individuals who are more likely to be out in the community, either at work or at social gatherings, that sort of thing. So continue to please be very, very careful. And then finally, our positivity graph. So as a reminder, the very jaggedy orange line represents the number of Montgomery County residents that was tested on that particular day. And then the blue line is the percent of those individuals that tested positive. And I'm happy to tell you, very happy to tell you, that this number continues to go down slowly, but it is going down. We are current on this as of August the 7th. We do have to build in a lag with this because we don't get enough test results meaningful or accurate. So as of August the 7th, we are running a positivity of 2.77%. And that has certainly been the lowest that we've seen in, really since this started. And so again, great news, and keep up the good work. So as a reminder, in case you need reminding, here's what you can do to make sure that our numbers stay this low. Don't leave home without a mask. Put it on whenever you're within 6 feet of someone who is not in your household. Just don't leave home without that mask. Even if you're just going for a walk in your neighborhood, just put it in your pocket. That way, if you run into a neighbor, you can just quickly slip it on. That is the safest thing you can do. Keep 6 feet distance from anyone not in your household. Keep your hands clean and away from your face as much as you can. Get tested if you need to or want to, and cooperate with contact tracing if you do test positive. Things continue to improve with our contact tracing. We continue to have now anywhere between 94 and 96% of people that we contact cooperate fully, so that's fantastic. And I want to remind you again that if you do get called, why it's so important to cooperate. First of all, we can notify direct exposures officially, or direct contacts officially, that they've been exposed, and instruct them what it means to quarantine and how to go about doing that. We're also able to provide help. We have the ability to offer no-cost hotel rooms for individuals who can't quarantine safely in their own homes. We have the ability to help coordinate other unmet needs. Maybe you got a phone call and you were just getting ready to go to the grocery store and there's not much food in your house. 2 weeks is a long time to not go to the grocery store. So we can help make sure that you're able to get food and other necessities delivered. Tracing is largely being conducted through community partners. Those partners are ACLAMO, the Visiting Nurses Association, or VNA, Family Services of Montgomery County, Montgomery County OIC, and individuals at the Montgomery County Office of Public Health. So you could see any of those agency names show up in your caller ID. You might also see the word unknown. Particularly in the case of the Office of Public Health, the way our phone system is set up, our numbers often come up as unknown. So if you see any of those, please answer the phone, because it may be somebody trying to reach you to let you know that you've been exposed. When we get good contact tracing, we learn from that information, and we can let you know the type of activities that are putting individuals at risk. And we also hear a lot from constituents, and I just want to share a story that was shared with me recently from a constituent who's in their 70s. This person has typical allergies, but in the late spring started to experience some very unusual symptoms. The first thing was a rash on both legs below the knees. Shortly after that, they started to feel very cold all the time. Now, they had difficulty sleeping, but they were also extremely tired. They lost their appetite and began to have fuzzy thinking. A headache and dizziness developed with a slight increase in temperature. Then they developed pink eye. So that sounds like a crazy constellation of symptoms, but that is what you can see with this disease. Particularly in older individuals, you may not get that sort of initial set of symptoms that we all focused on, which were a dry cough and a temperature and difficulty breathing. Sometimes, particularly in older individuals, you may see some of these more unusual things, like a rash or some discoloration in the toes. It may be more a sense of or a slight increase in temperature. Older people don't always get a big jump in their temperature. So I just want to share this story as a reminder that if you're not feeling well, or you're feeling strange or funny, just please stay home and communicate with your healthcare provider and get tested if you think you need to. That's the best way to stay safe. All right, with that, I am going to turn over to Commissioner Ken Lawrence.
Good afternoon, everyone. Today I am going to talk about the 2020 census. First, I would like to thank all of the Montgomery County residents who have responded to the 2020 census, and I'd like to appeal to those of you who have not to please do so. As of this week, Montgomery County's self-response rate is at 74%, so this is only 1 point away from the 75% we achieved in 2010. Non-response follow-up is underway, and numerators are out in the community trying to contact those who have not responded to the census. So if you don't want someone to knock on your door, a great way to keep that from happening is to go online and respond to the census. Completing the census is critical to getting money the county deserves to fund important programs for schools, senior programs, transportation, businesses, safety net programs that help serve underserved communities. And as we've seen during this pandemic, disparities that previously existed have gotten worse. We want to make sure that we get every dollar that we're entitled to. And Montgomery County is at risk of losing more than $75 million if we are undercounted by just 5%. We've also received word that from the census that the deadlines have changed and are earlier than previously stated. So the new deadline to submit all responses to the census is September 30th, so just over a month away. So if you have not responded to the census yet, please do it today. It takes about 5 minutes. If you are unable to locate your forms or the website link, you can go to www.montcopa.org/census2020. You can find information on how to respond in over a dozen languages online and find phone numbers that you can respond in over 50 languages. So thanks to everyone who's already done so. But if you have not responded to the census, if you do not want someone knocking on your door, please go online and do that today. And that concludes my report.
Thanks, Commissioner Lawrence. All right, I will just remind everyone that our next virtual briefing will be next Wednesday, August the 19th at 3 p.m. and happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Jimena Condi from WHYY and Jim Melward from KYW. And we will start this afternoon with Jimena.
I actually don't have anything, but thank you.
Thank you.
Okay, thanks. Move on to Mr. Melward then.
Start off, I know you mentioned Mako, and that's gonna start, you said, early next week. But yesterday, I'm curious what the county is seeing. Yesterday, Dr. Levine said in a conversation with LabCorp, they learned that they're able to turn results around in 1 to 2 days. Quest put out a press release saying their average turnaround's 2 to 3 days. The governor has said that Pennsylvania varies on the priority schedule because so many other states are seeing outbreaks. Knowing that you're not the only one doing tests, I'm just wondering if you're hearing anything or if contact tracing is finding anything about specifically those two labs, about Quest and LabCorp, about is it getting better? Is it the same?
Well, the county is currently using Quest, and we improvement. One of the challenges that we would have is we only know the lab that our county site tests come from. We don't have any information on what the other, like the hospitals all send some of their tests out. I think the drugstores that are offering testing are also, they're obviously sending out tests to either Quest or LabCorp, maybe both, I'm not sure which. So I don't really have a good feel on how all of them are doing, but I can tell you for us that we're still seeing several days, for the most part. I think it's a little better than it was, but as I presented today, we had some test results from almost a month ago, or 3 weeks ago, I guess. So what's going to be nice for us about Mako is that they are obligated. It is in our contract to give us a 36-hour turnaround time. And they are actually opening new capacity in order to accommodate our testing. So we will be a top priority for them and actually using capacity that is currently not being used by someone else. So I think for our residents, this is the most important thing. We want to make sure that people who need or want to be tested can get tested reliably get those results back quickly. And that's going to be particularly important as we move toward many individuals who are going back or hoping to go back to college, as well as people that are starting to return to work. Many of those individuals are being asked to provide proof of a negative test within a certain number of days, and it's usually not more than 72 hours. So I'm very hopeful that we'll be able to accommodate our constituents' needs for that type of testing as well.
The governor last week, or I guess the Department of Education last week, came out with updated metrics for schools reopening. I wonder your thoughts on them, and specifically where you feel Montgomery County schools fall on those metrics and how school districts could use those or should view those.
Mm-hmm. Yeah, well, as you know, I've been working very closely with all 22 of our school superintendents for weeks now, along with members of our health department. And what we're seeing across the county is a variety of responses to the pandemic. Some of our school districts will be going all virtual. Some will be having more of a hybrid model. And it really depends on the situation at each school district, what their facilities look like in terms of the size of classrooms, how many students are in different grades, potentially within those classrooms, what their ancillary spaces are, like gymnasiums or other places where they could set up classrooms. So it's been a very much of a district by district assessment of their ability and their facility options, and each one making a decision that in coordination with their parents, with their teachers, and with their students. So each of those school boards has been working very, very hard to do the best they can for each of their school districts. So in terms of the guidance, I was very happy to see that the governor did put out guidance. Guidance is particularly important in this instance because while our school districts may be geographically bound within the county for the most part, the teachers and other staff that work at these school districts often come from our surrounding counties. And so I think taking a more regional approach to this is very important. The county, Montgomery County itself, meets one of the metrics quite well, which is our positivity rate is very much in the low risk category. But our incidence of cases is still, hovering around or just below now that 50. And I don't know how quickly we're going to see that fall. We continue to slowly actually do more testing, so that absolute number of cases does continue to stay somewhere between 30 to 40 each day. So I don't know that we're going to see that incidence number get below what's required to be in the low category anytime soon. So look, this is a work in progress for everybody. We're all working together on this to help ensure the safety of all the students and teachers and their families. And we will keep at this. I continue to meet with the superintendents regularly and have no intention of stopping that. So we'll see what the next few weeks brings.
A lot of talk about sports. Obviously, PIAA was a headline. College sports are headlines this week. Last week, you mentioned your concern about youth sports. You didn't have numbers, and then when I reached out, you were able to get me numbers. And I'd love for you to explain this because it doesn't sound like the numbers quite match up with. Explain to me how these numbers match up with what you were saying, because what I got, and correct me if I'm wrong, 13 players associated with youth sports tested positive, and this is last week. I asked for updated numbers, and my understanding is you don't have updated numbers today. 7 of those 13 played or participated while they may have been contagious. 93 people were potentially exposed. As of late last week, the county knew of no one who'd been infected through youth sports. Explain where the concern is with that.
So I don't actually have the numbers in front of me, so I can't comment as to whether or not what you just shared with me is accurate, but it sounds, approximately right from what I remember when I looked at them the other day. So the point is that pull teams into quarantine. because they were not able to maintain social distancing while they were playing. So imagine that the school year had started, and now we're putting entire teams into quarantine because of that, while, ideally they would actually be able to be learning and focused on learning. We also have not had enough time in many cases go by to know whether or not any of those exposed individuals are actually going to end up becoming infected. But it's a question of, when we see that many people infected who are positive, who are maybe not, I think in all these cases, not aware they were positive, but definitely causing direct exposures to other people, meaning that they were within 6 feet of other people for longer than 15 minutes, then that takes a whole nother cohort of people that have to go out into quarantine. So as we look at trying to make the situation as safe as possible for our schools and for our community as a whole, youth sports is something that we've seen can cause some pretty significant, substantial exposure pretty quickly. So I was very pleased to see that PIAA is slowing this down and asking everyone to wait 2 weeks. I do think it's possible to do conditioning exercises and drills, but actually playing games can lead to high rates of exposure to large numbers of people. And even if just a handful of those people become positive, well, then you've potentially passed the virus to other schools, other staff at those schools. We saw this happen in the early days, how quickly this virus can explode in a community. So we're trying to prevent that from happening again.
So then it sounds like you feel youth sports couldn't really get underway until we do better at testing or vaccine or something else?
I think that any activity where people cannot have a mask on and maintain 6-foot distance consistently, any activity that falls into that category is higher risk. Until we have a vaccine, that is going to be our situation.
I'm just checking. I think those were the questions I had. Yeah, I think that's it. I'm good.
Okay, thanks.
We have no further questions today.
All right, great. Well, thank you, everybody, and we will see you next Wednesday at 3. Take care.